Step 6, time to heal. Great to have you back. So, by now, hopefully, you're getting a progression of how it's all joining together and how it's all interrelated. But today, for the next session, we're looking at particularly grief. So, look, understanding grief, what is grief and what is mourning, and looking at that, and then really looking at the common signs and symptoms that are associated with grief. Because depending on where you're working, you're either going to see a lot of grief that's associated with death or dying, or you're still going to see some significant grief just associated with diagnosis and lifestyle change, because all of our patients are going through significant change. And as I said, I've deliberately followed grief and helping you to understand grief better, because everything, all the changes that happen to us, to our patients, to our families and friends, put us into a grief response. So it's understanding the signs and symptoms associated with grief, and then looking at strategies, how to manage grief in others, but then particularly how to manage grief within yourself. So once again, sit back, relax, and enjoy in the privacy and comfort of your own home, and I'll see you at the end of this.
Step 6, time to heal. Thank you so much for joining me again in the privacy and comfort of your own home. Today we're looking at grief, or this session specifically looks at grief and strategies for managing grief in yourself as well as others. And I've deliberately followed change with grief because, as you may or may not realize yet, any significant change in your life and in my life will produce a grief reaction. In a previous session, I spoke about postnatal depression. I have a real fascination and interest in postnatal depression. I believe in some cases it's treated incorrectly. Postnatal depression, in my opinion, should be treated more like a grief response or a grief reaction, because the mums are dealing with a sense of real or perceived loss of something. Something is either really lost or it's only imagined that it's lost. But any significant change in your life, in my life, in an organization's life, will produce grief, a grief response, and the emotions that come with grief. So once again, if we look at Queensland Health, the significant change that is happening is causing mass grief and the emotions that go with it. I'm not too sure they're actually aware of that, but change and grief are directly linked. They're totally related. So let's look at some definitions of grief. Grief is the normal response or reaction to a loss. I can't stress that enough. It's a normal response or a normal reaction to a loss. The normal process of reacting both internally and externally to the perception of loss. Once again, I mentioned that word perception previously. The psychological, behavioral, social, and physical reactions to loss of something or someone that is closely tied to a person's identity. So these are just some definitions. Grief reactions may be seen in response to physical or tangible losses, i.e. the physical loss. Death is an example of a physical loss, or in response to a symbolic or psychological loss, i.e. divorce, loss of job, retrenchment. Once again, very real in our current workplace in Queensland. There's been some significant change, which sometimes it's a physical loss and sometimes it's an intangible or a symbolic loss. But nevertheless, we cannot diminish that's what's happening inside our current state, inside our current health system. There is significant grief which is occurring. And once again, I'm not too sure if the government is aware of that. But that, in my opinion, is truly what we're dealing with, the emotional reactions associated with grief. And grief, I think the general public have a belief that grief is just associated with death and dying. They're absolutely right, but it's more than just death or dying. It's associated with change, lifestyle change. So if I can stretch your way of thinking, if you haven't thought about that already, or join some of the dots that I've been leading to, any significant change in your life, in my life, will produce a grief response. Even the happy, positive occasions that produce stress, as we spoke about right back in step 2, getting married, buying your first house, having children, incredibly great occasion, happy, positive occasions. But quite often there will be a grief reaction associated with that because there will be some real losses and there'll be some perceived losses. Really interesting, really interesting. I'll keep going. So, what is mourning? Once again, these two sometimes get used synonymously in the same sentence, but it's a little bit different. Grief is more the outward expression of that loss. Mourning involves culturally determined rituals that help the bereaved individual make sense of the end of the loved one's life and give structure to what can feel like a very confusing time. Therefore, while the internal pain of grief is a more universal phenomena, how people mourn is influenced by their personal, familiar, cultural, religious, societal beliefs and customs. There it is again, that word beliefs. Everything from how families prepare themselves and their loved ones for death, and understanding and react to the passing, to the practices for preserving memories of the deceased, the funeral or memorial, burial, cremation, or other ways of handling the remains. So, once again, mourning is very much the external expression, where grief is very much an internal process. A little bit like stress and pressure. Pressure could be perceived as the mourning, the outward expression. It's an external element. And grief, very much associated with stress, is an internal mechanism. I think that's probably the best definition that we have of that. But we see grief and mourning very much in our profession. It's a huge part of our profession, and I'm not totally convinced we deal with it or prepare our young students that well for it. Nevertheless, that's one of my missions. And I'm hoping for, if there's any new grads out there listening now, to really begin to prepare and understand grief, what it looks like, what it feels like, what it sounds like, so you can be better equipped to manage it, because you will be confronted with it. So let's look at the grieving process. And once again, Kubler-Ross did this, I think, way back in the 60s. Assessed a whole lot of cancer patients, and she came up with the 5 stages of grief. Denial, this can't be happening to me. Anger, one of our core emotions. Why is this happening? Who is to blame? Why me? Why us? Why now? I don't deserve this. And it can go on and on and on. But anger is very much associated with the grieving process. Bargaining, trying to make sense of what has happened. And trying to bargain with a higher power. Make this not happen and I'll return to doing something better. I've caught myself numerous times in various situations bargaining, praying that something doesn't happen, and if it doesn't happen, I will then do this. Really interesting concept to examine. Depression, I'm too sad to do anything. Acceptance, I'm at peace with what has happened. It's a very simplistic process that was described by Kubler-Ross. I'd like to think I've built upon that with regards to the performance model. Because if you haven't realized it already, the performance model is about managing grief and working your way through it. And to me, the performance model, I'm quite proud of, because it really evolved out of working with the cancer population and understanding them more, and also understanding myself and looking at what works and what doesn't work with them, and what do they actually need and what don't they need. But the grieving process is universally known and accepted, but I'd like to think we could do more with it. And it definitely doesn't flow. There's still a lot of hurdles to contend with through that process. So grieving is the process of emotional and life adjustment change you go through after a loss, which can be real or perceived. Grieving is a personal experience. Depending on who you are and the nature of your loss, your process of grieving will be different from another person's experience. There is no normal and expected period of time for grieving. Our Western society really likes to put time frames on everything. And one of my close friends several years ago lost her child to meningitis. And it was an extremely traumatic event, as you could imagine. And I think it still is today. But it's developed some other belief systems within her that some are empowering and some are very disempowering. And the research suggests that mums and parents who lose children it can actually take up to around 7 years for them to really begin to look at some acceptance of that event. Once again, it's a highly significant event because if you really want to be take the emotion out of it, it's an event, but it's quite a significant event. I sometimes drift when I'm looking after some children. Now being a parent myself, putting myself in the parent's shoes as I do when I nurse, and I can sometimes feel their anxiety, their grief, their impending grief, their anger, their confusion, trying to make sense of what is actually happening to them and their child and their loved one, and it's just heartbreaking. And maybe that's one of the reasons why I've begun to step out away from the clinical setting and more into this setting where I can help people prepare themselves so they're better equipped to manage some of those situations. But nevertheless, once again, our health profession really has a huge focus, or should have a much bigger focus on understanding grief and how to manage grief, because all of our patients are put into circumstances where they're either suffering real or perceived losses. Therefore, they automatically have to slip into a grieving process. Some will be shallow, some will be deep. And it's going to be the deep ones that are going to be very challenging to you, to the organization, to the ward, to the unit, whatever it is. But understanding that, nevertheless, it's still a grieving process. It is a process, and there's certain emotions that go with it, and how you manage those emotions are significantly important. I think that's probably all I have to say around the definition. So I hope that's making more sense. But understanding that it's all about change, any significant change, real or perceived, will put us into that grief experience. And it's a deeply personal and very subjective. Very subjective. We could never understand what that person was going through. Once again, because of their values and belief systems. But now let's look at signs and symptoms of grief. Once again, excuse Homer. Once again, these aren't going to be totally unfamiliar to you. But if we look at the physical signs and symptoms of grief, there's fatigue and exhaustion. They have problems sleeping. Their appetite, they fluctuate. Most of them don't feel like eating. Muscle tremors. In the severe cases, the initial trauma or the initial event, sometimes people can have trouble breathing. Obviously, blood pressure can increase. Once again, it's a direct stress response. GIT upsets their belly. They get a belly. Their belly gets upset. Nausea and or dizziness. So once again, many physical effects. And once again, what one person gets will be completely different to another person. It's very hard to predict. We never know how our families and our loved ones are going to respond in these situations. But these are just some general signs and symptoms of grief. Once again, if you look at them, some of these are very similar to stress, because grief is one of those significant stresses that we have in our life. We recently had to put down one of my first dogs that we got. So he was 12 years old, and and this is the interesting things with beliefs. I never knew how I was going to react or respond to the event until I was in the event. I was thinking I was going to handle it very coolly and calmly, and I really lost it. I really broke down and cried. And I took my little girl with me, my little 7-year-old, because I really believe our children need to be aware of the circle of life, that important people and animals in their life will die at some stage. And I don't want to shelter her from that. So I took her and we said our goodbyes. We washed him the day before and gave him some really nice food. And I did all the preparation in weeks and months prior to the lead in, knowing that one day I was going to have to make a decision that was going to change our family dynamics and to put one of our loved ones, one of our favorite pets down. And when the event happened, I got really emotional. I got really sad. So once again, really normal emotions. And my little girl got really sad. But when we debriefed together, I said, "Why were you crying?" She said, "I was only crying because you were crying." Which was lovely, really lovely. But nevertheless, these are the emotions that we go through. And when it's sometimes very hard to predict how we're going to respond, how you're going to respond to an event until you're in the event. And that's what makes it a little bit challenging sometimes. Some of the mental signs and symptoms of grief, we've got fear, shock. Anger, that there's that word anger again, one of our core emotions, the most destructive emotion that man has. Irritability, agitation, guilt, numbness, depression, that lovely word we gets thrown around in our Western society. Anxiety, apprehension, inability to make decisions. Once again, we know that when we're under severe stress, our mental capacity to make decisions is sometimes challenged. Grief is no different. Very, very challenging. And once again, I can reflect to the passing of our dog. My decision making for the next couple of days was not what it normally is, and I still had that sense of sadness of mild depression, thinking, oh, that's really sad, something's missing. And I know for some of you who aren't dog lovers, you won't be able to step into my shoes, but those of you who are dog lovers will absolutely know where I'm coming from. So once again, these are just generic signs and symptoms, but once again, looking at these words, these mental signs and symptoms of grief, very, very similar, common with stress. Very similar again. Stress and grief are tightly related. Some of the emotional signs and symptoms, we've got the confusion, not able to concentrate, impaired judgment, not comprehension issues, memory not working, unwanted thoughts, nightmares. Become we Some of us can become disassociated. By that I mean our feelings. We can become quite detached, and we're unable to express emotions, which is awful. We have denial. We get sad. We have that disbelief. Some of us can become withdrawn. We have that sense of guilt. So once again, these are just generic signs and symptoms of emotions that are associated with grief. And once again, as we've just gone through these, the mental, physical, and the emotional signs and symptoms, if you can reflect to times where you've had a loss, a significant loss, are these familiar? Do you remember that time? I'm not going to ask you to go back to that time, but if I were, I'm sure you'd be able to relate to some of these words and to some of these signs and symptoms because they're universal. No matter what culture, no matter where we live in the world, because of our human capacity to grieve and to have that our express our emotions, this stuff is very universal. Cultures and religions will do it in a slight variations of this, but the raw emotions, the physical and mental aspects, signs and symptoms are still very, very common. Myths and facts. There's plenty of those around when we're looking at grief and loss. But let's look at the first one. The pain will go away faster if you ignore it. Wrong. Trying to ignore your pain or the pain or keep it from surfacing will only make it worse in the long run. For real healing, it is necessary to face your grief and to actively deal with it. And once again, if we cast our mind right back to step 2 and step 3, really looking at managing stress, all of those factors can assist in that. And once again, meditation is a key element in that. But let's look at myth number 2. Myth 2, it's important to be strong in the face of loss. Dum dum. Wrong. Feeling sad, feeling frightened or lonely is a normal reaction to loss. Crying doesn't mean that you're weak. You don't need to protect your family or your friends by putting a brave face on. Show your true feelings. Really, go ahead and just show your true feelings, and this can help not only you, but them as well. And I sometimes see this in families wanting to protect or rescue people from actually feeling what they actually need to feel to deal with the loss so they can actually move forward. Because before the healing and that whole process can truly occur, we need to be able to deal with the stuff that we're dealing with. So it's okay to be sad. It's okay to feel frightened. It's okay to cry. These are normal emotions, normal reactions. We must remember that. Myth number 3, if you don't cry, it means you aren't sorry about the loss. Once again, very, very wrong. Crying is a normal response to sadness, but it's not the only one. Those who don't cry may feel the pain just as deeply as others. They just may have a different way of showing it. So once again, we've got to be careful that we're not pushing our values and beliefs onto somebody else. And sometimes this can happen from time to time. I'm very guilty of this myself. Once again, pushing my beliefs about how grief should be, my values around how grief and the reactions should be. So we need to be very, very careful. Once again, grief is very, very subjective. Everyone does it differently. There's some universal stuff, absolutely. But at the end of the day, we all do this stuff very, very differently. Grief should last about a year, which is our final myth. There is no wrong or right time frame for grieving. How long it takes can differ from person to person. Once again, but there is very much in our Western society, in our employment areas, sometimes grief does have a time frame or a perceived time frame. I think in our career paths, it's recommended 3 to 4 weeks should be a normal time of grief, so we can get back to work and get on top of it. But once again, unfortunately, it's not that simple for some people. It can be very deep and very long lasting. I mentioned a friend of mine who lost her child to meningitis many years ago, and research now supports that people who lose children at a very young age, that grieving process can last up to 7 years. 7 years. So once again, it's very subjective. It's a very unique experience, and we need just to be aware and also to be careful that we don't push our values and beliefs onto that person or to that family. But that's enough for the myths. Now let's get into some strategies, some stuff that you can begin to apply straight away, particularly if you're working in those areas of cancer, ICU, A&E, all of those areas from time to time and sometimes from day to day experience significant amount of grief. And once again, grief isn't necessarily associated with death or dying. Please remember that. It's always associated with change. But particularly for I'm hoping there's a lot of new grads out there, and I've had a lot of students come through my program, and this is really for you because I really feel, and I'm going to mind read, or I'm going to assume that the older generation of us nurses kind of have an understanding and a grip of how to really manage grief in others. But if we're just looking at the new grad, and once again, this is a good refresher that we can look at the immediate or initial phase. The event's just happened. The event is a person passing on. So, in my opinion and in my belief and what I teach when I'm out there clinically facilitating, we need to provide privacy. Absolutely, we need time to give plenty of time to the families and the loved ones to really allow it to really sink in. But once again, time and privacy, incredibly important. And once again, sometimes in our busy wards and our busy tasks from day to day, we forget some of these really basic things. But we need to provide privacy. We need to give the family and the loved ones plenty of time. We need to listen more carefully. And once again, listening with our hearts more so than with our ears sometimes. We need to maintain that high level of respect and dignity. That might mean cleaning and or washing, decluttering, getting rid of all that medical equipment. I've been in some rooms where it's just overloaded with technology and equipment that doesn't need to be there. And just once again, it's about that maintaining that respect and dignity for that person, cleaning them up. If they need to be cleaned up, clean them up. Once again, this is the perfect time to step into someone else's shoes. If that was your loved one, how would you like them to be treated? How would you like to be treated in that time of pain and discomfort and in grief? Please step into someone else's shoes. Begin to think how and feel how they must be feeling and thinking at that immediate time. So once again, just a quick summary of what we're looking at. Just in the immediate initial phase, we need to provide that privacy. We need to give plenty of time. We need to listen with our hearts. Need to maintain a high level of respect and dignity at all times. If there's any cleaning or washing to be done, do it. Do it effectively and quickly. And declutter. Get rid of all the stuff that doesn't need to be there. So once again, family and friends can really come in and just share that final special moment with their loved ones. Some practical things that need to be considered. Contacting relatives and family. Sometimes the people who are there are too grief-stricken to actually be able to make some decisions. So this can help. But yeah, contacting relatives and families that need to be contacted, providing phone access, and seek guidance from the families and friends. Get their input. What do they want to happen? Provide the relevant contact numbers that are needed, i.e., for funeral services, and just to be there as for that immediate emotional and psychological support if required. Sometimes some nurses feel they have to be able to say something. And if I could stress here, the power of silence is a really, really powerful tool. Sometimes you just need to be there in the room with them, holding their hands, comforting them. Sometimes you don't need to say any words at all, just that physical body being there with them so they feel safe and supported is quite often all they need. But once again, really practical stuff that you should be able to do on the ward. Help them contact their relatives and families. Give that phone support and access. Seek guidance from the families. What do they want? Get their input. Help them find the relevant numbers that they may need, i.e., for funeral services. And just to be there, prepared, ready to be that emotional and psychological support if needed. Really simple stuff, guys, but very, very human. The intermediate phase is once again implementing the ward policies and procedures. Every ward will have their own specific ways of doing things. And it's going to be very different from ward to ward, from hospital to hospital, from private and public. Every ward, unit, department is going to be very different. So it's really up to you to take responsibility and accountability to find this out for yourself, and also to seek guidance from your peers and your senior staff members. I always believe it's truly important to evaluate what worked well and what didn't work well, and then also to continue that monitoring of family and staff. So be alert. For some staff, if it's a new experience, it can be incredibly traumatic. So please be alert. If you're the staff member on, please be alert, not only to the family and friends of the loved one who's just passed, but also to your colleagues, to your staff. Once again, we will never know how we're going to respond to an event until we're in that event. So please be careful, be alert, and look out for your mates, look out for your colleagues. And once again, you can't go too far wrong. The in phase, once again, I really believe it's very important for a staff debrief. For the people who are in direct care and directly involved in the care of that patient and their families, a staff debrief is very important to once again reevaluate what worked really well and what didn't work well. And really, I still believe it's the role of the senior staff there. If people are struggling, if your colleagues, if your mates, if your friends are really struggling because they got a little bit too close to that person, they may need to be redirected for further support and counselling. Once again, it's not a sign of weakness. I think it's a beautiful sign of being human, being able to be there in the moment, boots and all, and getting into the emotion, but also understanding yourself and protecting yourself. And to me, it's about discussing the learnings, both the professional and the personal learnings. What did you learn from this event? What could be done better? But also, what happened really well? What happened so well that it needs to be highlighted to other staff members? And once again, it's going to be different from ward to ward, department to department, unit to unit. So once again, it's up to you to take greater responsibility and accountability to once again take care of your mates, but understand the policies and procedures, and to really have that structured debrief, and to really reevaluate what's been working and what hasn't been working. Now, as we're approaching the end of this session, I really want to spend a little bit more time on strategies for managing grief within yourself. Because once again, we're not immune to how our patients can affect us from time to time. So for me, the very first thing you need to do, and this is all a part of self-care and can be easily wrapped up with meditation as well, but you need to give yourself space for processing. Allow lots and lots and lots of space, as much space as you need. For me, I sometimes get a little bit claustrophobic by technology and by being indoors. And for me, to get outside, get into nature, so you can actually, breathe that fresh air and just see how magnificent nature is, but also giving you that beautiful time and space that you actually really need, particularly at a neurological level. If it's been a severe traumatic event, absolutely, you need a lot of space for processing. Some of us tend to take our work home as well, so we need to be really aware of that. Do you take your stress home? Do you take your grief home? So once again, hopefully from step 2, you've been able to identify what does stress you and how do you currently manage that stress? Because once again, this can be a significant stressor, dealing with other people's grief, and then how do you deal with your own grief? To me, and it's also about patience and pampering. I'm still learning how to take or manage to get better patience, but as far as it goes towards assisting with healing and coping with the grieving process, patience and pampering is an important element. So it's allowing the grieving process to flow without placing meaning onto it. Quite often we'd love to give everything meaning, and in some situations it's really hard to find meaning. So once again, because it is a process and we're dealing with human emotions, we need to allow it to flow and not to be so judgmental, not to be hard on ourselves, not to be hard on our colleagues and our mates. Just think about that. Once again, about being patient. As I said, this is something I'm still learning, and it can be difficult sometimes. Accept help from others. I've seen so many nurses and even close family and friends who, when they're under stress or going through significant change, which has caused some significant grief, they still want to do it all by themselves. People, we can't do it by ourselves. It's okay to ask for help. It's absolutely okay to ask for help. It's human. And I'm sure you've got many, many family and friends who are just waiting there to help you if you're actually already in an event. But please ask help, okay? And develop a self-care ritual. As I said, meditation, develop that habit of meditation. But if that's not for you, do something else, but develop a habit. Develop something that's going to help you take greater care of you. For my wife, it's a combination of running every day and doing yoga 3 to 4 times a week. That's her self-care. For me, it's about, once again, getting immersed into my meditation, but also finding that quiet time where I can just reflect over what's been happening or what's coming. There's really good evidence to suggest journaling, meditation, and hobbies play a huge role in that self-care aspect. I've mentioned about hobbies before. It's where do you get your energy from? Where do you get your energy from? And that's what you should be doing more of, particularly in these times of grief or change. Get immersed in your hobby. So time disappears and your energy is incredibly high. But once again, guys, no one can do this except for you. People can advise, guide, direct, support, but it's all up to you. You still have to take that responsibility and accountability for yourself. I won't go any further. I think I've got my point. Once again, that self-love, do what energizes you, very much linked to your hobby. Do what you love and do more of it. And just love yourself. Begin to let go of all that stuff that you may have held on to for years and decades. Just let go of that stuff because it's not real. You are absolutely perfect the way you are, and you're absolutely perfect the way you're not. Nothing needs to change. You just need to let go and embrace other stuff. Embrace the change. But please, please, love yourself. Patience and pampering. We all need it. Once again, Homer pops back up. But it's also about the learnings. What have you learned about yourself as a result of this event? To me, this is more and more evident. In the older I get, I'm still learning. I did have a belief system that when you're an adult, you're supposed to know everything. Far from it. I have not learnt so much in the last 5 to 6 years exploring and researching all of this professional development stuff. And it's absolutely all about the learning about yourself, learning about others, but really, particularly those two elements of values and beliefs. What makes you tick? Really interesting. Because if you become more aware of how you manage stress, grief, and change, you're going to experience a very different life. Once again, the awareness. Everything's about the awareness. Awareness and acknowledgement of your belief systems. Is it known or not known? Is it empowering or disempowering? And once again, as I said, we're never going to know how we're going to respond to an event, i.e., a change or a significant grief event, until we're in it. Until we're in it. So when you're in it, begin to get really curious about your actual belief system. Become aware of it. What's it telling you? And how's it making you feel? Therefore, is it known? Is it not known? If it's not known, get really curious. If it's known, is it empowering or disempowering? And get curious and look at, you still have choices to help you make better decisions. If you're feeling like you're in a disempowered state as a result of a change which has caused you to feel sad and depressed, get excited, because now it's time to get aware. What's happening? What is your belief system around that stuff? Get to know it and get to understand, is it empowering or disempowering? Time, once again, we've kind of mentioned it with patience and pampering, but allow quality time for processing. Once again, in our Western world, it's so fast paced. We can lose it. We can get lost in it so quickly. Be patient and kind to yourself. There's no wrong or right time. And become more aware of the present. Become more aware of the present. I think that's, once again, I think one of the biggest take home messages that I can leave you with is we need to give ourselves plenty of time. We need to be patient and kind and understand there's no right or wrong time, and just become aware of the present. If possible, to begin to let go of the past. Focus on the future, but focus on what you want, but be much, much more aware of what's happening to you right now, how you're feeling, how you're thinking, what you're telling yourself, and so on. But they're my tips for managing grief within yourself. A brief grief summary, which kind of rhymes. So, once again, grieving is that process of emotional and life adjustment change you go through after a loss. And it can be real or perceived, because the brain doesn't really understand if it's real or perceived. It still believes it's real. It is a personal experience. So depending on who you are and the nature of your loss, your process of grieving will be very different from another person's experience. There is no normal and expected period of time for grieving. Some people adjust to new life events within several weeks or months. Others take a year or more, particularly when their daily life has been radically changed or lost through a traumatic or unexpected event. So, guys, we're getting very close to wrapping up this session. So I hope this has made sense. As the main points is firstly understanding that grief and change is very, very much linked together. The greater the change, the greater the grief response. Here in Queensland, as I said, we're going through significant change within the healthcare system. Therefore, there's a lot of people who are going through the grieving process. There's a lot of angry people, there's a lot of fearful people. Nevertheless, it's still a very normal reaction to a loss that's either real or perceived. This leads me to this point, that is there a link in here somewhere? And I absolutely believe there is. I believe that a person's belief system is a predictor of how he or she will respond to a situation, circumstances, or events where there has been a perceived or real loss. Therefore, if you want to change your reaction to your grief response, you can. You can simply look at your belief system. Therefore, if you can change your belief, you can absolutely change your grief response. Because imagine if you thought grief, or if you thought dying and death, that there was a beautiful afterlife. And once again, we're not going to look at any religion, but if you could just imagine that there's an incredible afterlife waiting for us all, There's no more pain, there's no more suffering. We're incredibly empowered, we're enlightened, and we're spiritual beings that have this incredible potential. Would that make knowing that the death of a loved one or the dying of a loved one might be a little bit more, I don't know, exciting or interesting or not as painful? I don't know. But we all have a belief system about death and dying. So my advice or suggestion is to get really familiar to what it is so you can do some mental preparation. But there still is an absolute link between what you believe and how you grieve. So guys, I really hope this has been helpful. Once again, we've looked at the signs and symptoms. We've looked at really the causes of grief, and the causes in a generic context is just change. Any change will put us into a grief response. The greater the change, the greater the grief reaction. We've looked at a few myths, we've looked at managing grief in others, and now we've looked at grief in self, managing grief. So guys, I'm going to see you very, very soon at our coaching corner. And it's my pleasure to once again, I'll be seeing you very, very soon. Thank you so much for your time, for your patience. I'm really hoping you're getting a lot from this series because it's been an absolute pleasure bringing it to you. But I will see you very, very soon for your key learnings and the coaching corner. Have a great day. Bye-bye.
Welcome back. So now, Coaching Corner and key learnings. With Coaching Corner, it's, once again, because it's around grief, it's a very personal one. Normally in the live trainings, we don't share this, but for your purpose, it'd be really interesting for you and I to understand, how do you currently manage your grief? So question one, how do you currently manage grief? And if you can break that into two, how do you currently manage grief in others? And how do you manage grief in yourself? If you can go back to a time where you've experienced some significant change, how did you manage that? How did you cope with that? And then once again, how did you manage grief and mourning in others? Once again, this is really personal stuff. You don't need to share this stuff. And then what did you find most useful in particularly listening to the strategies for others and self? What were the strategies that you think, that'd be great for me, that you can really take ownership of and begin to apply in your own life? So once again, write that down. What strategy was the most significant to you that you can begin to apply in your own life, be it others or self? And then once again, what are your key learnings? What did you learn about grief, mourning, the signs and symptoms, and the strategies? And once again, guys, this is really important that you get down your key learnings. It might only be one, but if it's more than one, that's great, whatever it is, but get it on paper. What was your key learning for this particular session? That's it. Thanks so much for joining with me. We're almost there. We're almost at step 7. Once again, I've been really excited to share this with you. And I'll see you next step. Take care.